Hi, I'm Alicia.
And I'm Robin, and you're listening to Bowel Moments,
the podcast sharing real talk about the realities of IBD. Served on the rocks. This week we talked to Nicole and Luke Pavlin. Nicole has been dealing with GI symptoms since 2005 and wasn't diagnosed with her Crohn's disease until 2016. Luke is her supportive husband and care partner. We talked to them about Nicole's diagnosis process and the very unusual complication that made her Crohn's disease significantly worse. We talked to her about getting her care at Mount Sinai in New York and participating in the GRITT program, including some research studies and getting support for her food anxiety and PTSD from medical trauma. And we talked to her about her new volunteer role with Nutrition for IBD, a nonprofit that focuses on nutrition support for inflammatory bowel disease. Cheers.
Hi, everybody. Welcome to Bowel Moments. This is Robin.
Hey, guys. This is Alicia, and we are super excited to be joined by not one, but two folks tonight. So welcome to the show, Nicole and Luke Pavlin. Welcome to the show, guys.
Thanks for having us.
Yeah, thanks for having us.
Well, we are very, very excited to hear your collective story and sort of who you are in this relationship. But we're going to start out by asking you the very unprofessional question of what are you drinking?
Tonight, we're drinking smoothies.
Oh,
He's a really good sport because I usually have one a day and it's too much volume for just me to drink the whole thing. So he splits it with me.
Oh, very nice. What kind of smoothie?
So usually I try to work in like a protein, a veggie, fruit kind of thing. So it's like there's yogurt, soy milk, nut butter. There's like strawberries, blueberries, avocado for a little bit of creaminess, so a little bit of cinnamon.
That sounds really good. When you said protein, I immediately was like, chicken? So I was like, that's a
whole other smoothie.
That was why my face was a little like, oh no.
Yeah.
Protein comes in other forms, Alicia. Comes in
plenty
other
of plant protein out there, you know?
Wow. Okay.
We're off to a great start, Alicia. Off to a great start.
Lord, Robin. Oh, yeah. I feel like this is pretty much every time. Robin, what are you drinking?
I am boring tonight because it is the busiest time of year for me at work. So I'm drinking water because I was working right up until this call and I'll be working after it. So work.
You're Brianna now. I am drinking a rosé tonight. Next question for y'all. Tell us your IBD story. And so just to start you out, Nicole, you are the one that is living with inflammatory bowel disease and Luke is your husband. So give us your story and feel free to jump in, Luke, whenever you feel like you have color to add.
That's correct. I'm the one with IBD, but it affects the whole family. So, he's a part of the help too. And he fills in the gaps in my memory, which is helpful. So I have Crohn's disease of the small bowel, ileum and jejunum. The first clue that I had any issues was 2005, but I officially got my diagnosis from the Mount Sinai IBD Center in March of 2021. So my disease course was very complicated because I actually had a birth defect as well, which we didn't discover until exploratory surgery in 2022. And this birth defect is called a Meckel's diverticulum, which actually affects about 2% of the population. But most people, if they have an issue with it, usually figure it out when they're children. So it's very rare for it to give a problem as an adult. But I think the combination of the Crohn's and the Meckel's diverticulum together were probably making each other worse. And what happened was, so the Meckel's is like a pouch. It's like a little remnant of a pouch. And it contains cells sometimes that are gastric, sometimes that are pancreatic. Mine were gastric, so it's producing acid and causing ulceration. And this caused a lot of bleeding episodes, and occasionally I had to be hospitalized with extensive bleeding. And it was a mystery for a long time. So I had a really big bleed in 2005, emergency hospitalization. I had to go in the ICU. I had to get blood transfusion, and we couldn't really figure out the source of the bleeding. I had a bunch of scans. I had scope scans. The only thing that really gave a clue was the video capsule endoscopy, which showed scattered inflammation and ulceration. So we were thinking I probably had mild Crohn's. And, I got married. We moved up to North Jersey. I focused on raising a family. That all kind of resolved itself. My symptoms were very mild until 2020 during the pandemic, where things got just out of control. And my lifestyle changed. I had a course of antibiotics. Who knows what caused it, but I flared. And we didn't really know what was causing all this bleeding and abdominal pain. I had all these scopes and tests, like blood work, stool tests. So MREs, really nothing was showing what was causing the bleeding. And I started losing weight. and, had trouble eating certain foods and things like that. And what led me to Mount Sinai was when I had another video capsule endoscopy, but this time it got stuck. So I got to be a patient at Mount Sinai because it was stuck and we were trying to figure out what to do. And Mount Sinai has procedures that I couldn't find elsewhere. So what we decided to do first was put me on a biologic. So I started with Inflectra. Unfortunately, that failed me. And that's when things really, really went downhill. And I thought I was getting better, but then all of a sudden, I guess I built up antibodies to the Inflectra. And then the fall of 2021, when I happened to be part of this study through Mount Sinai, this wearable device study, it captured what happened. And there's some clues, as far as heart rate variability that were captured that kind of showed something was going on in hindsight. But at the time, we didn't know why my symptoms were getting worse. And I progressively had less and less I was able to tolerate as far as food. Luckily, I had also support from a dietitian at Mount Sinai, and she helped me to modify my food, and she helped me to, eventually I was on a full liquid diet, and then I had emergency hospitalization, and that's when we figured out that the Inflectra had stopped working. So we went on a new treatment plan. I was on budesonide and Humira, and I also tried EEN, exclusive enteral nutrition. And then I was getting better. And then the winter of 2022, I started to try to reintroduce food. And I wasn't even able to reintroduce bananas and even potatoes. And then I got less and less that I was able to tolerate, where I couldn't even tolerate enough liquid nutrition. And we decided to do exploratory surgery. And I took a dive. I took a dive in and like a trust fall, right? And we actually found the problem. We found the major problem, which was the Meckel's diverticulum. It was removed. And since then, I haven't had any major bleeds. I've had a slow bleed, which we're not sure why, but the Meckel's, having that removed, really put me in a position where I could get much better. And the Humira, I'm on the Humira. But the thing is, I've also developed food anxiety and I've developed PTSD. So I have mental health support at Mount Sinai through the IBD Center. So essentially, I have this wellness tripod now at the IBD Center, which I read in Christine Rich's book, Chronic, because I had read this, while my symptoms were getting bad and I lost all this weight, like 60 pounds. And I saw in her book, it said, set yourself up with a wellness tripod. So that's what I did at Mount Sinai. I got my GI dietitian, IBD focused GI dietitian. I got my IBD focused gastroenterologist, and I have my IBD focused mental health support. I have access to a pharmacist. I have access to a GI psychologist, GI surgeon. So it's been a whole team. And my case was so complex that I really needed that team. They essentially saved my life, because I really think they did, because I was getting in a really bad situation where my weight was really low. And I mean, Luke can tell you how bad I got. I essentially looked at like a skeleton at a certain point. Right now, I'm in the recovery stage. I'm rebuilding. I'm working back the food. I'm dealing with some of the food fears, and I've made a lot of progress. There have been some bumps in the road. I have PTSD, so we can talk through that. I've had different episodes where my heart races. There's tachycardia, which I can't control. And I've also had bowel emptying with it, like a fight or flight type response. And what really helped me with that was going on a beta blocker. And so I take a nightly beta blocker. And since I've been on that at night, I've been much better. But before I got on that, I was really going through this anxiety spiral, especially once I got COVID, because then I felt like, I didn't feel safe in my own body, but then I also didn't feel safe with the germs around me from COVID. And it affected my GI system too when I got COVID. So here I am, I am pretty well maintained on the Humira, and I have this slow bleed. We're not sure where it's coming from. But unfortunately, where I've been, it's just tough to know what's going on. So it's somewhere in my small intestine. There's a small bleed, but it's somewhere we can't reach with traditional scopes. So I'm at this point where really what makes most sense is just to maintain my iron levels with iron supplementation. So I'm getting IV iron treatments and I'm taking oral iron as well. And we're trying to get my levels back up. On top of that, I'm taking care of the PTSD with mental health support. I'm working on the food anxiety with the dietitian. And really, it's a matter of, as long as the bleed doesn't get worse, then I think I can maintain it pretty well. And if it does get worse, then the next step would be probably something like a double balloon enteroscopy, which I've had one of those before, but we we didn't find anything because it was from the top down. The next step would be go from the bottom up. But there's risks to that. And another option is, I could potentially do exploratory surgery again. But at this point, why rock the boat? So we're at this point where the waters are fairly calm, and we're kind of staying on the boat and seeing if I can maintain with the iron. The Humira so far seems to be working, and that's kind of where I am right now. Did I miss anything major, Luke?
I think you hit all the major points.
Okay.
I'd say, when you look at the two events, like 2005 was like very acute. It happened and then it was just kind of over. And then they just couldn't figure out what had happened. And then she managed her disease just through like exercise, did yoga class, swimming, good diet. And so it was just like no medicine whatsoever. So you had this long period, 15 years. And then, what was frustrating in 2020 is just that you just see like you're progressively getting worse. And like, no matter what the doctors are doing, like you're not getting an answer, you're not figuring out. And so it's working through that frustration. And then, on top of it, it was not being able to tolerate certain foods. I mean, she would be laid up on the couch or on the bed just because, there was so much pain from the gas for like, hours at a time sometimes.
Yeah, and that was a part of the mental health journey as well, because really in the fall of 2021 is when things got really bad as far as the food anxiety and the food fears and the disordered eating. But, there's a fine line that's very nuanced because there's an adaptive eating as well. So, I was tolerating less and less, but then I started to get afraid of the food. And, I got to the point where I was only on a liquid diet and I still ended up in the hospital, so after that situation, after the surgery, I knew that the pouch was gone, but I was still afraid to eat. And I remember when I was bringing back food, I think I cried, when I first started just chewing food because I was scared. I was really scared to just chew food, solid food. But this is where Mount Sinai has been so huge in helping me because there's such a great support network there. And the dietitian there has been absolutely amazing, her support. She's helped me so much with modifications and moral support and, like working through my restrictive behaviors and things like that to give me the confidence and the courage to keep going forward, and mental health too. So they're working together, and the two of them are just fantastic. I even gave them a nickname. I gave them a team name because they helped me to reintroduce chocolate. And so once I was so happy when we reintroduced chocolate, and they both have an M in their name, so I gave them Team M&M. I call them Team M&M.
That's cute.
So Team M&M has been amazing, and they've taken me through lots of ups and downs, but I'm making lots of progress.
Part of what you're talking about is a program that they refer to as the GRITT program. Is that correct?
Correct.
So you've given us a great introduction of kind of how that goes. How was that introduced to you? And is there any other aspects of the program that you think are really important for people to know about? Because it's a really awesome, like you said, very holistic program view of patient care.
Right. So GRIT stands for Gaining Resilience Through Transitions. And the idea is that no matter what life brings you, because you have no idea what's around the corner, right? There's all these life transitions, having kids. If you're younger, going through school, going through college, or going through, just high school, whatever level you're at, there's all these different life stages. There's work stress. There's all different kinds of things that can happen. And really, they're trying to make you resilient so that you can bounce back from whatever happens. It could be an illness in another family member, like a car accident, who knows? Something happens where you should be able to, with these skills, with these tools, bounce back from things that happen. And like I said, there have been ups and downs for me, like COVID, for example. When I got COVID, it really hit me hard mentally because it did affect my GI system. And I also got norovirus, so it's like these things that they're things that are just thrown at you. But I've learned, okay, well, I got to kind of go through the feelings, go through the fears, and let the waves come through and learn to surf the waves, right? So they're kind of like teaching us how to surf. But yeah, so the GRIT program, I think they do give you kind of like a score, and you kind of can, in a way, graduate, I think, once they feel like you're pretty independent. And I think I'm kind of getting there. I love their support, and I like to, they're always there for me. They say that, they're always there if we need them. But yeah, I think it's a matter of helping us navigate, and they work together as a team. So like I said, there's dietitian, there's a mental health provider. They have social workers as well as, there's a GI psychologist. they have pharmacist, GI doctor team. So, they're all talking about your case. It's not that they have access to your medical records. It's that they're actually conversing with each other at the IBD center, and they're working together on your case.
So how was this introduced to you though? So when you first went to Mount Sinai, was it just like, because presumably you made an appointment with a gastroenterologist, the IBD center.
Mhm.
When was it when they introduced this program to you as another adjunct to help you?
So yeah, when I first got into Mount Sinai and I had an appointment with the GI doctor. So we talked about medication, and then so I actually discovered all this on my own, kind of online through their Mount Sinai website to see what was available for resources. And I saw that there's nutrition support available. So I asked, can I get a consult with a dietitian? And that was when I was already on a restricted diet, which is low FODMAP diet, and I wanted to come back from it. And so I had a meeting with the dietitian, and she got me back to eating FODMAPs within weeks. And yeah, it's amazing. So I had been on it for longer than I should have been, and she got me off of it very quickly. And then when I started getting better, but then the fall of 2021, I started getting worse. And then the mental health toll with the eating and everything, that's when I put in a referral for mental health. I actually asked again, I said, can I get a mental health referral? And so I was on a waiting list, but then eventually in December, I got a mental health support. I think officially then once I had that tripod, right, then I think I was probably officially part of the program. But I also did a research study with the behavioral health support, and that lasted for a year. So I was, I guess, part of the GRITT program, but also doing the research at the same time. And that was really just answering surveys about, my support.
And I just want to point out too that sometimes it's hard to get the help that you need. I just want to say that because sometimes I just don't even want to ask for help because sometimes it is hard to get the help that you need. But sometimes you can just ask for help and get it. You're on a wait list or they'll give you a referral and it works out. And sometimes I put on my calendar, I'm going to try again in September, or I'm going to try again in December, or I'm going to try again in April, or whatever it looks like, because it has been hard to get help. But don't let that stop you from advocating for yourself, because like a lot of our guests have said, I hate this word and I'm going to say it and Alicia's going to laugh at me. It is a journey for the rest of our lives. I really can't believe I just said journey because I hate that word so much, but it's not going away. So you have to just kind of gird your loins and try again. So I'm so super happy that you went on the website and looked to see what was available to you for yourself and then asked for that. You're it's here, you have it, I'm going to ask for it. I didn't mean to stop your train of thought, but I just wanted to point that out for the now 20 people that are listening. You can ask for the support that you need.
Yeah, kudos for looking up and finding the place that you knew you were going to get what you needed, and for knowing that that was something you needed to go down. I mean, as a science educator, of course, you probably have a little more knowledge than the average bear when it comes to what's available, but you found what you needed. And I think that can be really difficult for people to do, especially when they're feeling so overwhelmed and sick. So that's amazing. So as part of this, because you mentioned talking to the dietitian about having that food anxiety, food fear, straight up fear. Anxiety is such a tame word for what it is. And the mental health, how do they work together on that? Because that's not just a diet thing. Mm-hmm. There is the mental health component. So it's fantastic to have that, like you said, your sort of triad. It's not
all the above. Yeah.
The thing. You have your pentaverate of assistants. How did they work together without giving out too much information?
I mean, essentially, there's the portal. You can always go through the portal to communicate with each person separately or, through telehealth, but they would talk with each other. So I would meet with each of them individually and they would talk with each other. And there is such an intersection because, there is very much a mental health overlap with this. And, as far as me moving forward with food, it's really a lot of taking care of the mental health issue at the same time. Before I move forward with certain foods, I have to make sure that, mentally I can handle it, because if I'm afraid to eat a banana and I get myself all worked up about it, then I could kind of create those symptoms artificially, right? Yeah, there's a huge mental component. And they would, for example, the two of them would say, it's a lot about exposure. So from both of their perspectives, it's a matter of, okay, trying a certain food and how does it work for you for a few days? And the mental health side would tell me, for example, maybe to take deep breaths or do some kind of calming exercise or visualization to help me, as far as keeping myself calm when I'd eat a certain food. But there is such an overlap because you're talking about body image issues as well and comments. I'm sure a lot of people you've talked to probably told you that, when you lose all this weight, you get all these comments and these positive comments, right? And that's just kind of a symptom of our society. They're really well-intentioned, I think, but they don't realize how it affects us. I remember hearing somebody say something like, getting a stomach bug. Oh, I'd lose some weight by getting the stomach bug. And for me, hearing that really was like, I did get the stomach bug, and it threw me into this really, this whole other place mentally, because I thought I was having trouble with the Crohn's, so. Yeah. So anyway, there's definitely this overlap between mental health and eating behaviors. It's behavior, right? It's not just the food itself. It's your behavior around the food. So really, it's a matter of them meeting with me individually and then, talking to each other separately and kind of coming up with a plan.
Yeah. So they have sort of joint language around like, okay, we're going to approach this in two parts as you go and start introducing these new foods. That's really cool. Your kids are young. And so I am curious how your reaction to food and feeling this like level of fear and anxiety around it, did that ripple into your kids' lives at all? Like, did they start developing some like, ooh, bananas are scary kind of like, did they have any kind of echoes of that as they were eating? Or were they like, mom is different?
That's a great question. I was afraid of that. And I think, well, they're picky eaters in general. So,
yeah.
Right. They're already picky eaters. So it's like mom's a picky eater too, so that doesn't help for sure. But I don't think there was any behaviors that they developed. Do you think they got different with food?
With food? No. I mean, it was more so since they were younger, trying to explain to them, like, why isn't mom feeling well? And like, what's going on? And our son who's older, like, I mean, it was, I guess, very timely. It was like right before the surgery, he had a 5th grade science project on the digestive system. And I was like, they're using like pasta to like remake it. And so like, to like make a model of it. And so I could explain, they need to take this part out of mom because, something's not working right here. So it's like, he could more get it. Whereas like, our daughter who was in 2nd grade going into 3rd grade, it's like, how do you explain that to a 7-8-year-old,
Yeah, but we've been very open with them about this whole thing. And I feel like this generally, kids are they're more resilient than you give them credit for. And if you don't teach them how to bounce back up, they're not going to know what to do. So it's like when they're a toddler and they fall and you're like, oh no, you fell. And then they're like, oh no, I fell. But if you're just there to support them, then they're like, oh, no big deal. I fell, I'll get back up. So it's a matter of, okay, mom had some really tough times and how did she navigate it? And that's one reason I wanted to come on the podcast too, to talk about some of the ways that I've navigated these tough situations, whether it's food anxiety or PTSD, which we can get into too, because that's been really helpful with Mount Sinai. And I also have a trauma therapist as well, getting me to calm my nervous system down because it's something that I have a tough time. It just happens. I can't control it. A lot of times it would happen in the middle of the night and wake me up. I would have, nightmares, intrusive memories, intrusive thoughts, things like that. And sometimes I would wake up, and the kids, would wake up too and like, what's wrong with mom? But, we navigate it together as a family and they help me too. With the PTSD, my daughter gave me her stuffed animal and I take a stuffed animal with me to my infusions and it helps calm me down. And I take a stuffed animal when I go to New York City because that's one thing when I just can't help it sometimes. When I get close to Mount Sinai, my heart rate just goes up. I get lightheaded. I can't help it. But I'm getting better. As I get closer to Mount Sinai, every time I go in, as I get closer, I can go further without and sometimes I've had to take the beta blocker. But the last time I went in, I didn't, which is great progress.
That is great progress. I understand that completely. Oh, that's a tough one. Yeah, I hate that. My chest gets tight. I start crying uncontrollably. No control. Yeah. It is getting better too. I'm glad that it's getting better for you.
Do you have a tip, Robin, that works for you?
My therapist recently started EMDR with me, so that's what's been helping me. So
I've thought about trying that. That's on the table. There are different things on the table, and also medication. So I had a consultation with the GI psychologist, and I could do something like an SSRI to help the serotonin keep flowing. So there's different options, but for now, the beta blocker seems to be helping, and the cognitive behavioral therapy, the talk therapy, that's helping too. But each of us has a different way of viewing the world, right? It's fascinating to me because we're all kind of wired differently. We take in these experiences differently. And as IBD patients, we all experience IBD slightly differently too.
Yes.
Our triggers, mentally and physically are different. We all have a slightly different microbiome, which I'm fascinated by as well as a science person. But yeah, it's a matter of what works for each of us. And I think we're each kind of a piece of the puzzle, and you share what works for you. Maybe it helps somebody else figure out what works for them. And therapy has been huge. I'm so glad that I have a therapist. I'm so glad that I have a dietitian. And of course, my gastroenterologist, my surgeon, the whole team, they're just fantastic.
I'm curious for your therapy. You said you have a trauma-informed therapist. Robin's therapist use EMDR, but I know there are some other techniques. Have there been any techniques that she's taught you in addition to the cognitive behavioral therapy?
So far, that's what I've needed. I think there are more that we could try, but it actually works really well with me. I'm very open to talking, and all the exercises seem to work pretty well with me. Like, one thing we work through is, if I have a negative thought, you get curious about it. Why am I having this thought? We have so many thoughts, and so there's so many that are not true, right? They just pop in there. It's your brain kind of figuring out the world and everything. So, all right, why am I having this thought? Should I just let it go down the stream? A lot of times we'll just let it go down the stream and not fixate on it. Yeah. So actually I did mention, I did have some like intrusive memories and thoughts and nightmares and things like that. And one thing that was really bothering me after the surgery as I was recovering was this image of myself. Like I said, I looked like a skeleton essentially at a certain point. And this image of myself kept popping in my head. And so one thing I did with the mental health therapist at Mount Sinai is a journaling exercise. She told me to write down everything about that image in my head that I could picture, all the emotions it brings up, everything about it. So I just stream of thought, wrote down everything I could think of. And then, I thought about, well, why am I scared of this image? Why am I scared of this skeleton? And then I just realized to myself, I really don't have to be. I don't have to be scared. Skeletons don't have to be scary. It's like with my kids, it's just a skeleton. Everybody's a skeleton underneath. And then so I came up with this poem that really shifted my perspective. And I wrote it very quickly, actually. And it's called 109 and 206. And 109 was my weight, my lowest weight. 206 for the bones that I have in my body. So on the left side of the poem is everything I was feeling at my weakest state at 109 and how fragile I was feeling. And then, I realized that the bones are always underneath and they can be kind of a source of strength too. That's your framework. That's your foundation, your core, right? So on the other side of the poem, 206 is that strength. It's the inner strength and all that, all that humanity you have inside of you, that resilience, the compassion you have for yourself. And that's where I focused on, is shifting my perspective and rebuilding. And then after that poem, I wasn't afraid of the skeleton really anymore. And I thought, oh, now I'm fixed. I don't need any therapy anymore. I wrote the poem. But of course, now I still need therapy. I still have stuff to work through.
That's the shitty part about therapy is you're like, I'm good, check. And then you're like, oh, no, there's.
I know, I journaled it. I wrote a poem. Come on.
Exactly. You're like, I should be done, right? Grade A, ready. Oh, yeah, therapy sucks. It's great. It's so wonderful. Right? It's a lot of work. That's really lovely. And
sure, maybe one day I'll publish it. We'll see. I have other things jiggling in my head for poems and whatnot. So who knows?
I love that. I love the creativity and using that creative outlet to really process through that. I think that's really super cool. Yeah. Awesome.
I mean, I was kind of using all these tools that I have, and everybody kind of has their own experience that they're coming with. So like science, I'm a science educator. So I would look up research articles in my hospital bed. I'd be reading research articles, and that's how I knew to do, to ask about certain procedures. And actually I got to do a bowel ultrasound, which was really cool. I was reading about that, and then it just happened that they have that at Mount Sinai. So
that's so cool.
You weren't there for that. My dad was there for that, but yeah, it was really cool to see. And, I'm hopeful that that's kind of a non-invasive option for monitoring. And for people like me with PTSD, that needles and procedures can be, really tough for us.
Absolutely.
So it makes me hopeful that, there are other things on the horizon.
Yeah. And we have had a couple of guests that are talking about abdominal ultrasounds that we know this is a thing and definitely are interested in our listeners, all 20 of them, learning more about it, because you're right. It's such a unique thing that is not invasive. And, some of the pediatric docs are even talking about how, they have the kids do it themselves. Like they hand them the little wand and show them how to do it. And like, how empowering is that to make that part of your experience with your doctor?
Definitely. Yeah. And ultrasounds, I mean, I get them for my heart. I get them for monitoring, like for gynecology. So, why not for bowels too?
Vincey's episode has definitely aired, Vincey and Jamie's. And we talked to Vincey about GI ultrasound. So
Yes, that's true. It has. And we talked about it there because they had at the DDW conference, there was people there that were like showing it off and showing their colleagues how to do it. So it's very cool. And it's super helpful for those folks who that imaging can work for them. I know it's like, obviously, if you have Crohn's disease, it doesn't work the same way, but
And if you have J pouches, nope. And if you have upper GI Crohn's, nope. But for everybody else,
sorry,
Some
Robin.
people, if it works for some, we can be happy for them, right?
that's right. Yeah,
That's
absolutely. Right. That's what thumbs up. Nobody can see me, but for everybody else, yes. I'm down for everybody else. Yes.
Those are definitely thumbs up. I can see them.
Those are definitely thumbs up. Not in a sarcastic way at all.
But speaking of advances and things that are sort of new and cool, one of the things I really wanted both of you to talk about was you participated in a couple of research studies that were unique research studies. So I think people kind of assume clinical trials, you're testing a drug, whatever, but you were participating in some that were more related to wearable devices and different aspects of monitoring your disease. Will you talk about your experience there and let us know what that was like for both of you?
Yeah, sure. For the wearable device study, I started in July of 2021 and I ended in May of 2022. So I got to wear this Oura ring, which I still have, and I got to wear a Empatica wristband. I also had a body port scale. And so I would take daily measurements. A lot of the data I couldn't see, like for the Empatica wristband, I couldn't see the data that they collect. Well, I could see a little bit of it, but not too much. And then I could see when I weighed myself on the body port scale. And that definitely brought up some anxiety, weighing myself every day. And my dietitian was really bothered by that. I've since seen what it can do, weighing yourself every single day. I understand, the reason for it. And it was actually helpful to see how much weight I lost. I lost a total of 60 pounds over the course of, from 2020 to 2022. So, I would do surveys. I would do video call, like a video diary, and just kind of daily monitor, like for example, my readiness level on my Oura ring. I could see that. I could see, like how well I slept that night. And it was really interesting. It picked up certain trends, for example, with the tachycardia. And for a while, we weren't sure. We're still not totally positive that it's just PTSD with the tachycardia, but we couldn't find any other problems with my heart or anything like that. So, it would pick up some episodes of tachycardia, which was really interesting. It would pick up, trends in heart rate variability, which is really the big thing I think that they're focusing on as far as stress and how your body reacts to stress. And, there's a lot of potential for wearing these devices and picking up on certain signals that your body's under strain. It could be because of IBD, or it could be from something else like work-related stress or something like that, or a combination. So there's a lot of information we can collect on ourselves, which can be really, really useful. I also, outside of the study, have a cardiomobile device, which I can use for like a portable EKG. And that was helpful with the tachycardia too, to see if there was a rhythm issue. But there's so much to collect, so much data to collect. And I was in the study for 10 months, and they picked up this part of my journey, journey, you like that word, right? Where I was, I took a turn for the worse, and, it captured some of that. In hindsight, looking back at that data from my work, there were some interesting things that it picked up. So, the study's not published yet. The data is not published yet. So it's going to be really interesting to see what they come up with. But I think there's a lot of hope that these devices can actually help kind of predict when your body's going into some kind of stressful situation and possibly flares. So imagine if you can kind of get a warning. And it's so important to prevent the inflammation from getting worse, right? To stop it as soon as possible, and that's been a problem with getting diagnosed, but also knowing like when you're flaring and what's going on in there. So there's a lot of potential. Do you have anything to add on the devices?
I was so happy when the scale got put away and she no longer had to use it. I was totally with the dietitian on that. As far as if I were a researcher, I'd probably recommend they do that where it's done on a blind basis, where like it collects the data, but it doesn't just pop up, because it's like every day. And especially when, Nicole wasn't feeling the greatest, it's like you step on the scale and it's like, It's like, I'm down half a pound now. It's like, and there's a lot to be said for the whole like mind gut connection. And, this is a stress related disease. So by doing things like that, that was not a helpful aspect of the study. I'll put it that way.
But I understand why they were doing it. It's just a
Sure.
matter of maybe that shouldn't be visible to the patient, the weight part of it.
I think that's
But
good feedback.
yeah, and just, anybody considering these kinds of devices, it's a matter of moderation. So you can kind of, like, for example, I have this pulse ox too. And when I was having these tachycardia episodes, I'd be like checking myself every 5 minutes. And Luke would be like, okay, you don't need to check that much.
Yeah.
I'm like, did it go down yet? Did my heart rate go down yet? And then by checking myself, did I make my heart rate stay elevated? So there's this kind of feedback where if you overcheck, you can drive yourself crazy, with anxiety. It's useful in many ways, but also, with a cautionary note that overuse or like overchecking can really lead you into some anxiety.
Can make you hypersensitive.
Yeah. Yeah.
And and it's easier for me to say as, I'll say a healthy individual or an individual who does not have IBD, as far as like just trying to learn to trust your body and just how you're feeling. Like, how you feel. And just like going with those instincts, as opposed to just, well, the ring or the device says like, am I getting bad or not?
But I think that's interesting you say that, because that's one of the things Robin has brought up about her body is a big fat liar. And so, you mentioned just going with what your body says, but what we have heard, and granted, Robin, feel free to jump in because I'm speaking about you while you're in the room, is that, you can't trust your gut at that point. Like, you can't trust that your body is telling you the right things. And so sometimes having that external thing to say, hey, wait a second, this isn't right, can be helpful. Robin, you came off mute, thank goodness.
I do say that because oftentimes I can tell when things are going wrong, but like my blood work doesn't often reflect that yet. Like, I know by things that are happening physically that may not be reflected in tests yet. Like, the test won't show that something's wrong until it starts to get really bad. For just a prime example is when my iron starts dropping, my hair starts falling out, I start getting tired, those kinds of things start happening, but my blood will be fine. It will be perfectly fine. It won't show that my iron is low until it like goes from regular to like, we need to give you iron infusions. And so I've been telling doctors for a while, like, hey, I think my iron's low. Oh no, your blood work's fine. And then all of a sudden it's really low. It's like it dropped overnight or something. So for a long time, I just was like, I don't trust them. They're like, let's run tests. I'm like, I don't trust your tests. So you're going to have to find another way to see what's wrong, because your tests are not accurately describing what's happening in the body.
But you knew how you were feeling.
Oh yeah, 100%. Yeah.
From some of our other guests, they basically say they don't trust how they're feeling because they don't trust their bodies. So it is a tough one. And I think that's really why this is interesting, because you have these things like the Oura Ring or these wearable devices that help clue you in a little bit to try to maybe make that connection back to your body. But then how do you balance out getting feedback in a way that allows you to feel like, again, connect back to what your body is doing, but without scaring the shit out of you? Do you know what I mean? Like, or becoming so hyper focused on those readings and that measurement tool, like how do you, I don't know how you prevent the hyper fixation on like now just constantly monitoring yourself or constantly weighing yourself, or I don't know. That's a tough one for me.
I think that's where things like, whether it's like therapy, mindfulness, those techniques, it's like, that's where some of that stuff comes into play. So you're not just focused on, the app or the, device is telling you, you try and put things into context and, using other techniques.
Yeah, good point, to kind of make sure you're not just doing one piece of it. Don't just get an Oura Ring and start like tracking crap. Maybe just bringing people into
it's like with any technology, right? Technology can be great. It's just you have to use it wisely, right? It's like we tell our son now he has a smartphone. We're trying to navigate on, and maybe someday he'll have a wearable device. He actually knows quite a bit about the Oura Ring because he's looked it up, and that's been interesting for the kids too, to see the device study. And when I was doing that, of course they like anything with the screen, so I might show them the readout of the Oura Ring. That's pretty interesting to them. But it's a matter of like, how do you navigate it with some caution? That's all. But it can be very useful for sure.
I know heart rate variability has come up when we talked to Stacey Collins and Josie McGarva about Crohn's and Colitis Congress. The heart rate variability came up, or was it just Josie's episode? Anyway, Josie and heart rate variability, I'll link to that episode. That was one of the things that she was working on, is heart rate variability. And so that's one thing I know that they're like sort of looking at. Were there other pieces of your particular data? Because obviously we can't speak to the study quite yet. Was there anything of your particular data that you thought was interesting? Because you said there was some stuff that you went, that's fascinating, that it kind of coincided with when you weren't feeling well.
Well, for sure. I mean, I don't know. I can't speak to what the study was focusing on and collecting. We'll see once they publish, the information. But for me personally, the Aura Ring was the most helpful. And, I could see, for example, my body temperature elevation. I could see changes in my heart rate variability. You have an option to monitor daily, weekly, monthly. So like some of those trends, if you look at the whole picture, like monthly, you can kind of see right now my heart rate variability is actually fairly constant. But there are times where it's kind of like peaks and valleys. So resting heart rate is helpful. So when I get my readiness level in the morning, it tells me, what's my respiration rate, what's my heart rate variability, what's my heart rate overnight, and it comes up with the score that I get every day. And that could bring some anxiety too, because like, oh, I got in the 80s today, which is pretty good, but I really want to be in the 90s, or ooh, I got a 50. I had a really bad, bad night. So it's like, yeah, I know I had a bad night, and then I get this score. So there's your anxiety. So you really don't need some of the stuff per se, but it's really interesting, especially as a science person. It's just really fascinating. And I probably get a little too much into the science of it, and he laughs. I go down the science rabbit hole a little bit, but it's fun. It's fun for me. And it also, participating in the study made me feel like I was contributing, and all the suffering and the pain I was going through could be used for something. So I was glad that in that tough part, the really tough part, fall of 2021, that I was part of the study, because I felt like what I was going through, maybe even because I was suffering, it was tough for me, but maybe that could be used for somebody else, because they could help, in the future, help somebody in the future. So, I'm a big fan of participating in studies. I've participated in, I think, like 4 other studies at Mount Sinai, but that was the biggest one, the most involved one. So I like a COVID study, what else? The behavioral health study, like a post-operative study. Why not? Why not fill out some surveys and, get to wear fun devices? I love this kind of stuff.
Yeah, that is very cool. And it's a maybe lower entry point for a lot of people. Like I said, if you're not trying new medications, it probably feels a little bit different, I would imagine. Yeah, that's very cool. I love the idea of participating in some of these studies and some of these things that potentially help other people figure out how their disease is tracking. That's awesome. We've talked a lot about nutrition, and one of the groups that you're involved in is a nonprofit organization called NT for IBD. So I think that's nutrition therapy for inflammatory bowel disease. Is that correct?
Correct. Nutritional therapy for IBD or inflammatory bowel disease. Correct. Yeah. So I recently started volunteering with them. I just kind of discovered them on social media, and, I wish I had discovered them sooner, because they have fantastic resources and tools, and not just for patients, but for clinicians too. Really, the idea is to provide information, research-backed, evidence-based information on these diet therapies, these nutritional therapies. There's so many different options. Really, it's meant to be a guide for both the patient and the clinician to kind of build a plan together. And there's a recipe database, which is very extensive. It's like over 1,000 recipes. And they have a search option where you can filter by whatever diet you're on. So like Crohn's disease exclusion diet, for example, if you're on that, a certain phase of it, you can search for that. And what meals can I make with that? They also have just generally, if you're trying to eat, for example, a Mediterranean diet or generally healthy, so there are all these different kind of options. And it's a great resource, if you're, for example, like a clinician who would like to have a nutrition program, at your clinic. This is a great way to just see, evidence for certain diets and how nutrition actually matters. It does matter, and it helps you along the way with all these different resources and tools. And it's all free. It's free to access. It's a nonprofit run by volunteers. There's a medical advisory board. So there's a lot of great minds building this. And there's a lot going forward that you're going to see more often with them. And we're still kind of figuring out what my role is going to be with them, but the science education is going to fit in there somewhere. I like to go through research, and I like to communicate what I find with research. So I'll probably help out with that, and maybe some social media posts, things like that. But generally, yeah, I'm excited to volunteer with them, and I'm excited to see how they're going to help people. They've already been helping people since 2019, so they've done a lot of great help for patients, and it's a matter of getting the word out, I think. It's a really fantastic website, so much great information in there, and it's all carefully researched, and it's so well presented. I think everybody should check it out. It's really a great resource.
It's great. It sounds like a really fun volunteer opportunity as well, since you like science, and this is a great way for you to help distill down some of the research for folks to make it much more, oh God, this is not, no pun intended, digestible. Oh, I didn't even mean to do that.
Exactly. Digestible. Yeah, exactly. I mean, yeah, that's kind of my background, right? Is how do you communicate tough concepts to people? And I've done that for myself. I've done all this research myself. Why not do it for helping other people? I'll research and help other people and share it. And one other thing I want to mention is that they are very aware of like cultural sensitivities. So, if you have a certain cultural diet, helping you along to find ways that you can build a healthy diet that works with medicine too. It's not like either or, nutrition and medicine work together, right? So yeah, I'm excited to work with them, and there's a global perspective too. So IBD is all over, right? And that's one thing that this has really struck me, is that IBD affects all different kinds of people, all different backgrounds, all different situations. And going on social media and seeing how people are connected, whether it's like race, culture, socioeconomic level, anything, whatever your background is, IBD is not selective. It can affect anybody, right? So it's an interesting way that people have been kind of realizing that we have this common humanity. I guess I could put it that way. There's a common humanity. And going through this kind of stuff, I think, really makes you realize we are all human at the core, and we have these common feelings and reactions to really tough situations.
I love that you can sort and you can search by sort of the cultural nuances as well. I mean, it's one of the things that came up when we were talking to some of our folks from the South Asian IBD Alliance, was that they would start working with some dietitians, and the dietitians would hand them a sheet of paper and they'd be like, well, I don't eat any of these foods, and how alienating that can feel. So I love that that's part of what they're looking at, is how do you ensure that people can see themselves in the resources that are available. So that's cool. I love that. I glanced at their website quickly. It looks like they have a good group of folks that are, like you said, part of their medical advisory committee that are helping them make sure everything is really scientifically sound. So that's very cool. Luke, I'm curious, since you have been quite quiet in all of this, talk to me a little bit more about kind of just in general what it's been like for you to help navigate this, because I would imagine having small children, having lots of things happening, and then you put a pandemic in the middle of it, has created quite a bit of challenge. So talk a little bit about your role as the support partner in this IBD journey.
Sure. I mean, as a caregiver and, and a husband and just father, and just, you want your family to be well, and you want to be there to support your family. And then when someone's not well, it's very difficult, just to, watch them going through what they're going through. And there's nothing that you can do about it other than be supportive and make sure they're, trying to seek the care that they need. The first thing I'll say is ask for help, and whether it's like, because life goes on, but at the same time, it's like, the first was, at my work, and I was blessed enough where like at my job, I'd been there quite a while. So I was comfortable telling them, this is my situation, and my wife is not well, and I'm going to need to help out more at home, and I'm going to have less time, for work. And there were periods of time where I had to take family medical leave just to make sure that, taking care of folks. And then, with kids, it's very, well, people in general, it's like we need routines. And if you don't have a good routine, then it's like they can really throw you off and stuff. So, the kids had to adapt that, maybe dad doesn't cook as well as mom, but you're going to have to eat the food that dad makes because mom's just not able to do it, and we'd work through that it's just like, this is our situation. So we're going to have to work through it. I'm the youngest of four, so I'd reach out to my siblings just for my own like mental support and talking through with them. Very young in my life, when I was like 8 or 9, my mother had, suffered from skin cancer and ended up passing away from that. And I had an example of what not to do. So my father just had way too much stress going on, and like he turned alcohol, and so I told myself, I said, well, I know what I'm not going to do. I'm going to make sure I can take care of myself, be healthy. I'm not going to drink, and I'm just going to like be healthy so I can help take care of others and just lean on others as much as you can. And it's not easy sometimes to ask for help, but it's the only way that it's like helps you just like get through it,
I think that makes a lot of sense. But you're right. It is always difficult to ask for help. I think it's especially sometimes difficult for men to ask for help. So kudos to you for doing that, because that's not easy, but you're right. There are definitely healthier ways of coping with stress than others. And I think it kind of goes back to a little bit to what Nicole said before, though, about like, kids are resilient, but they're also super observant. And so even when they're little, they know something's going on. And so if you try to keep them in the dark, it makes things significantly worse. And so how do you create that environment that allows for conversation and question, and about what's happening, and giving the age appropriate responses so that everybody feels like they're kind of in the know. They feel really confident about what's happening. They have their routine. It may be pizza every night for a week, but that's okay, and that kind of stuff. So I think that's very smart. Good job. That's really hard to do, but and it's hard to watch your loved ones suffer. It's hard to watch somebody lose 60 pounds and feel like they're not themselves anymore. So that's tough.
And it's like, that something's not right. Robin was talking earlier about like, you feel something like, I know something's not right. Nicole, halfway through this process, like she goes in for an annual physical and the doctor's like, your results are great. Your blood work, your weight, everything. He's like, you are a model patient. And, she's like, I don't feel that way. I really don't feel that way. But, to be fair, it's like when you're just looking at the test results and like what, here's what the lab results are saying. It's like,
about 2020.
Yeah.
2020.
Yeah.
Oh, yeah.
Mhm.
Yeah.
Yeah.
I mean, it was still, I hadn't lost that much weight at that point, but yeah.
Yeah, but it was still,
Yeah.
and that's the thing though, is like when you have a process like that, where it's just like a little bit each month, you don't like, and even my family, they didn't even really realize until the fall of 2021 when, she first came out of the hospital and like they saw some pictures. Like my sister called me up. She's like, I cried when I saw that picture.
Yeah.
She's like, and I've been talking to her. She's like, I know you said that she's been going through so much, but she's like, I just didn't know. Like it was, the way it was.
Yeah. And that's the thing too, is there with IBD, as we know, it's an invisible illness, right? A lot of the time. So there's so much we're going through that people don't realize. And that's where the mental health comes in, right? It's such a huge toll. And it's so interesting because I am looking better. I am starting to feel better, but I still am dealing with this, getting through the PTSD and everything and working through all the food anxiety. And there's so much that people don't see, and it's kind of like, I feel like people see, probably see me as looking totally normal and I'm back to complete health and everything, but there's so much mental struggle still going on in there. I'm much, much better, but there's still a lot I'm working through, and my diet, I'm still trying to reintroduce things. It's just like right now, things that are easy to digest and soft, I'm starting to go back out to restaurants and things like that. But, it took a little while. For a while, I wasn't going out to restaurants, and it takes a lot of bravery. I think it takes a lot of courage to try something that you're afraid to do. But that's how you go forward. It's so tough, really tough to go forward, but it's that exposure. It's just trying it, whether it's food or whether it's an experience or, going to a hospital where, you suffered there. It's rewiring our brains, right? And this is what I've learned through therapy, is that there is hope because you can rewire your brain. You can think about things in a different way. So now what I've done when I go to New York City is I pair it with something fun. So Mount Sinai is right next to Central Park. So I'll go in for an appointment, but then I'll go to the garden, or I'll walk around the reservoir, or I'll go to the Belvedere Castle or something, and that's how I've kind of gotten through this, is I've paired it with something fun. So my mind and body, they don't associate me going there with trouble, danger, because I would see danger where there wasn't danger for a while. But now, because I'm rewiring and I'm associating with more positive things, I'm able to get closer and closer to Mount Sinai. And now finally, I didn't have to use the beta blocker last time, which was great progress.
That is awesome. And There's so many things that I want to talk to you about, but I have to ask you the last question. After everything that you shared with us, Nicole and Luke, what's the one thing that you want the IBD community to know? What's the nugget that you want them to take away from our conversation today?
Really, for me, is the hope. And that's what has gotten me through everything is, finding that hope where you feel like, how do I move forward? It could be something that you have trouble seeing and maybe you need to ask for help to find it. But that's really how you move forward is you find, all right, what's that next step? And it could be a very small step. It could be, all right, I'm going to try a banana today and see how I do. It could be something that's simple, or it could be, I'm going to try this one procedure, or maybe I'm going to take this beta blocker because I'm going to see what happens, or I'm going to try this exploratory surgery. What's that path forward? And there is that light there. And sometimes it's hard to see, but there is the light to move forward and keep moving forward. And like I said, support is huge. And sometimes you need help to get along the way. But there's so many people out there, so many resources. It's a matter of knowing what you need and asking for what you need.
For me, I would add on to that, whether you're a patient, a caregiver, family member, you are not alone. And, this is not just your burden to bear, what you're feeling. And so reach out to others and, you can instill hope in others, whether it's just listening to them and what they're going through or encouraging them, but to let them know that they're not alone and you are not alone.
Thank you both so much. That's what a lovely way to end the show. Thank you for joining us, and thank you everybody for listening, and cheers, everybody.
Thanks so much.
Hi, this is Nicole
and Luke.
If you enjoyed this episode, please rate, review, subscribe,
and share it with a friend.